Hi, everyone. You are here for the GeneSight Cares webinar. You are in the right place. We are going to let people trickle in. We'll give them a few minutes before we get started. For those who are coming in now, again, if you are here for the GeneSight Cares webinar, you are in the right place. We appreciate your punctuality, and we will give people just another minute or so to keep coming in before we get started. All right, so we know we have limited time tonight and we want to be respectful of the time you've already given us, so we will go ahead and get started tonight. My name is Dr. Rachel Earls. I am a neuroscientist and a member of the GeneSight Medical Affairs team, and I'm pleased to be here tonight to have a great chat with you. I just want to give you a few housekeeping items in the beginning. The recording of this session will be available on our GeneSight YouTube channel within the next couple of days. So there will be a recording available of this if you're not able to attend the entire time. If you have any questions, please put them in the Q&A feature, and we will do our best to answer them as we go through this process. So I'm so thrilled to share the next hour of our night together discussing how the holidays can be a time of fun, joy, and just incredible times for some. But then for others, holidays can be a real source of enormous stress and often may have a negative impact on people's mental health. So many of the upcoming expectations of the holidays can put strain on pretty much anyone, and clinicians are clearly not exempt to that. In fact, they may have additional stressors from what we have seen. So we have an amazing panel of clinicians here tonight who are going to share their tips and tactics for how they help their patients, as well as themselves, have happier holidays, and how GeneSight can be a part of that. They can help keep your patients on track heading into the new year and get a better handle on their mental health journey. So we'll start with introducing our wonderful panelist. Dr. Karsten Felkel is a pediatric psychiatrist and the system medical director for Bon Secours Mercy Health in Greenville, South Carolina. Thank you so much for being here tonight, Dr. Felkel.
Thanks for having me. Great to be here.
We also have Dr. Whitney Brown, who is a dual board-certified nurse practitioner in family practice and psychiatric mental health, as well as a full-time clinical assistant professor at the University of Alabama Capstone College of Nursing. Dr. Brown, we are thrilled to have you here. Thank you for being here tonight.
Thank you for having me, Rachel.
Of course. And last and certainly not least, Dr. Crystal Nelson. She is a psychiatrist and an owner of her own practice, Blueprint Psychiatry in Noonan, Georgia. Dr. Nelson, it's wonderful to see you again.
You as well, Rachel.
All right, so let's go ahead and get started. Let me start with you, Dr. Nelson. Do you see an uptick in visits in your practice before the holidays?
Yeah, I do. I probably would have said an immediate yes to that. For many, many years now, we have such an uptick in general. It's become a little bit more difficult to say it's at the holidays, but usually when the seasons start to change and we go into this time, we get a few more calls of people in distress for sure.
Is it for new patients or is it more visits from your current clients?
Both. So we get quite a few new patients the last quarter of the year, and then our current clients. I was talking to several people today, and I said, "Oh, we're in that time of year where everybody says my medicine isn't working anymore," and the medicine is working the same as it probably was in May, but because we have some other changes, they don't feel it's as effective sometimes when we hit this time of year.
Dr. Brown, what about you?
I would agree. I saw several patients today who said similar to what Dr. Nelson said. My medicine isn't working anymore, and essentially the depression or the anxiety was the umbrella or the cloud over everything. And so therapy had been helpful for some of them, but essentially the medicine did not seem to be filling those same voids as before. So I would say that I've seen an increase in complaints about depression or mood as it pertains to the weather and the seasons changing. And recently in my area of the country, we've had a lot of rain and just kind of gloomy days. And so that's been playing a large role as well. So I've definitely been getting a few calls.
Dr. Falco, so you're a child psychiatrist. So what do you see this time of year?
Well, any good child psychiatrist is also an adult psychiatrist, so we see the whole family. Um, Typical things are typical. We're just finished the first quarter, and we're propelling into end of the second quarter, end of the semester, where all these grades are going to be average for the kids, and parents are going to learn just how much their kids are struggling. And ADHD is pretty common, and so there's going to be some emotional crises as kids are struggling to focus. In my own family, I've got 3 boys, and so we're winding down in sports season, which means tournament time and travel, lack of sleep. And we went to our first holiday party last night. So while we were there, we left one of the kids at home on a screen. Just because I'm a psychiatrist doesn't mean I'm a great parent. And my wife is a therapist also. And so we've pretty much failed our kids. But more screen time for the kids means more wound up energy, more kind of self-destructive behaviors, more yelling on our part. And so really trying to figure out how to balance this very busy time. And in Greenville, South Carolina, it is at 7 o'clock right now, it is dark. And so people are definitely calling about their kids, just saying we need to change the medicines up or get started on a medicine.
That is a lot of factors at play. So there's situational factors, there's seasonal factors, there is the stress of holidays all kind of coming to a head at this time of year. So it does seem pretty natural that people may have a hard time handling this. Dr. Nelson, is there an increase in patient demands specific to a particular holiday, or do you think it's like we kind of talked about just this time of year in general?
I think you get a little bit of both. So one, we can't ignore the seasonal change, like Dr. Felkel said. I mean, same here. It's pitch black. And yesterday my son was at track practice. I mean, we're running in the darkness. And so you know, that leads to not only just environmentally us not getting everything that we would get when it's warmer, but picking up food, fast food, changing how we eat, getting more carbs in, less sleep, all of that. And then we throw on, I think, the heavy imagery we have about how the holidays are supposed to look and what they're supposed to feel like, and all of that, where our bodies are undergoing a little bit less to work with. So I think it's both. I think that the holidays, in combination with the seasonal changes, kind of create what we see on a mental health side.
So it sounds like expectations are playing a big role here, what we think we should feel, how we think this should look. And maybe if it doesn't look like that, that can lead to some unresolved mental health issues, if I'm hearing you correctly.
No, for sure. Expectations are, I say this probably, I don't know, 50 times in a day. I mean, expectations are everything. Most of our dissatisfaction has to do with unmet expectations, but sometimes our expectations aren't realistic. You know, if it's 32 degrees outside, but I expect myself to be as productive as I might when it's 70 degrees outside, that might not be realistic. I'm going to be going against my biology that says hibernate, get in the bed, it's cold. You know, and so same with holidays. If my expectations are what it was 3 years ago before we ever had a pandemic, that might not be as realistic this year, if your family has changed and life in general may have changed. So
That makes sense. So there's a lot of factors at play here which can affect how people are perceiving the holidays, perceiving their mental health. So I think this kind of just leads to a natural segue of what do you advise patients during this time? What do you say? I mean, when you hear all these different factors going into maybe their mental health crises and you're, you know, that your head, you're like, that makes sense why you're feeling that way. How do you advise them? What are your steps with your patients?
yeah, well, for me, first things first is we talk a lot about expectations. You know, how do you expect this holiday to go? I tell patients often start with the end in mind. So the holiday's over and you're home what do you want to remember about it? How do you want that holiday to have went? Did you want it to be relaxing? Did you want it to be exciting, adventurous? How did you want it to go so that you can plan accordingly? Sometimes people will say, I want my holiday to be relaxing. Well, then maybe you shouldn't go to grandma's house with 42 people there. That's probably not going to be relaxing. So just being realistic about how they want it to go and then build out that holiday season accordingly to the end in mind.
We can kind of go around the horn here. Dr. Falco, what do you think?
I think in the past, I've told people to just make it about you and to set limits. But as I've kind of, for example, in my own life, we've lost my grandmother this past year. Who moved in with us. She was 103. So my family has mourned her loss. My parents have moved to Greenville, which is a whole new scenario since I'm an only child. And for me, there's like priorities, and I can envision how I want things to go. But there's a lot of competing demands. And there's going to not be perfect scenarios, and there's pros and cons to every situation. And so I love that advice, Dr. Nelson, of really having the end in sight and working backwards. I think if I know someone is going to be, I'm going to feel stressed to be around them, but yet I also value family time and friendships, and I'm going to ultimately choose to be around them, then I have to prepare mentally for that scenario.
I think that's such an excellent point. I really resonated with me hearing the competing demands, knowing that this may bring you stress, but knowing that is something ultimately that you plan to do. So instead of avoiding it completely, just mentally preparing yourself for what's ahead and how you're probably going to feel during that time and arming yourself with that. I think that's wonderful. Dr. Brown, what about you?
I would agree with that. I would say that, everybody's situation is really different, but sometimes family means well, and it's not always a pleasant experience for someone. And then there are other people who are struggling with the loss of their loved ones. So I would agree with Dr. Felkel to make it about you, prioritize yourself, know your limits, essentially. I would encourage people to kind of set up a system. You know when it's time to tap out, know when it's time to remove yourself from that environment. And it's a really good time to employ boundaries for those times of the year where you may need a little bit more time to yourself, or you may need that family surrounding you for support to provide you with a distraction from what's actually troublesome or symptomatic. So those would be my recommendations there. And then just to kind of know who your support systems are, those people who can observe you in a room or in a family unit to say, hey, are you okay? If you're not able to express that at the time.
That's very insightful. And one question that makes me think of when you say setting boundaries, are boundaries during the holidays inherently different than the boundaries you set during the rest of the year? Or generally you think you kind of have those boundaries set for yourself the whole year?
I would say ultimately they're the same. It's just kind of how you choose to execute them in certain situations.
Right.
Everyone's boundaries are a little different, but employing, hey, I need my space, that is okay if you're like, I'm coming to the holiday party or I'm coming to the Thanksgiving dinner, but I'm leaving at 7. Or, going ahead and setting that time away so that you can decompress. As I mentioned before, everybody's experience with family is not the same. And although some people enjoy the encounters, other people may be overwhelmed. It may make them anxious or make them feel a pressure to feel or act as other people do during the holidays. So just a food for thought in general to know that everybody's a little different and their needs are different. So employing the boundaries may be executed differently, but ultimately they should be the same.
Yeah, I do think that sometimes during the holiday season, and I'm doing some support with some of my clients around this coming up, and Dr. Felko brought it up, and my condolences to you and your family. When you're dealing with grief at the holidays, sometimes enforcing those boundaries can be a little bit more difficult, I think, because there are expectations. If my traditions and my rituals include this, but now we don't have that family member, it's very difficult to keep going with those same traditions and those demands where, well, they want me here, but it's difficult for me to be here. It can be very difficult to set those boundaries. That's why I think, again, coming back to getting a clear understanding of how you want that holiday to go, communicating that. So if it's too difficult to spend the whole day, with your loved ones because you are grieving, communicating that up front, I want to be sure to see you, but I'm really early in my grief process here, so I might not be able to do all day, or I might not be able to do the whole holiday. It just depends on where you are. But I think that I've heard lots of clients talking about their concern about the holidays with, dealing with their grief and not wanting to do the holiday the same way, but feeling pressured to do it the same way. And so that takes a lot of bravery sometimes, depending upon the family, to say, hey, I don't want to do it the same way. I'm going to stay home.
Certainly.
So somebody has to really be comfortable with communicating that to their family members.
I don't know about you all, but in myself, my own life, as well as in my patients and my colleagues, it seems like grief at all times, but maybe especially on the holidays, manifests as busyness to avoid the grief.
Mhm.
And I think it's probably self-protective so that you can't always be crying and processing and mourning, but it does then bring a lot of internal conflicting feelings because you want to celebrate, but you also want to mourn, and it just gets confusing. And so
Mhm.
for me, self-care kind of around the holidays isn't, I wish it was a bubble bath, but it's actually more about me doing the hard work of like being mindful and paying attention to how I'm feeling in my body, and which is usually a lot of conflict and trying to figure out which signals to pay attention to. But I think this year I'm going to try to be less busy, which is easier said than done.
Mhm.
I would agree.
Absolutely. I've heard some healthcare providers say it's kind of intentional static, that it's a little bit easier to function with that low level noise you kind of hear in the background rather than actually sinking and
Yeah.
letting yourself feel all those conflicting feelings. So I definitely agree with that, Dr. Felkel. But Dr. Brown, I'm so sorry I cut you off. What were you going to say?
Oh, no, you're fine. I was just going to say sometimes people can feel isolated during the holidays. With that being said, the balance of the grief. But as Dr. Vogel said, the mindfulness, that's something that we share with our patients oftentimes, but it's oftentimes easier said than done to implement it. So I would definitely agree with kind of establishing it in advance who you can reach out to, if that's a therapist or a counselor, whatever that looks like, but kind of setting that up in advance. And definitely physical activity can help with that as well, kind of distracting you, but also it's a healthier outlet.
So we got a question related to isolation in the Q&A. So a lot of the conversations we've been having have been about setting boundaries for yourself with your family. But this person's attendee asked, what suggestions would you give to those who are isolated? So those who maybe don't have family during this time. And it sounds like some of the suggestions you just made, Dr. Brown, Dr. Felkel, Dr. Nelson, about mindfulness would be a big one. But and do you have any other advice for those who are isolated from family or loved ones during the holidays?
They can also use the concept of a gratitude box. You never know when you may experience a low moment. So if you can go ahead and create, that could be a shoe box or your box you create in wrapping paper, but you're putting items in there that remind you of peaceful times or happiness, those things that kind of stabilize you, whether it's a quote or a photo of a time that you experience peacefulness or happiness, and even just moments of gratitude that you've had throughout the year. Just write that on a piece of paper and store that for a later time to kind of reflect and reconnect.
I have quite a few patients in my practice that are seniors, and they are alone at the holiday time. So we talk about being able to fill your space, because you can be isolated or be physically alone, but you can fill your space. And I think that's where you can come up with a plan. So I talk to my seniors about, what's in the background of your house? What are you listening to? You can have music that makes you feel good playing. You can watch things on television, on your phone, on your tablets that are pleasing to you. You can plan that day out. I'm going to go out to eat at my favorite place. So just structuring the time so that it's filled with something, even when we don't have people. Fortunately and unfortunately, we're so tuned in and tapped in. We have access to everything. We can fill our space with the right things by way of sound and sight and all of that. So I tell them a lot, don't have the news, don't have the news playing in the background at all times. You might want to have music or, other things that they can fill their space with.
Absolutely.
Yeah, my wife, who's a therapist, probably does this more and better than I do, but she focuses a lot on exteroceptor input. So like basically you could think of every single sense that you have and you could do something to touch it in a way. I know that we have a lot of things that bring good memories, but we have a lot of kind of cinnamon smelling pine cones and candles around the house. And for someone who is lonely, this is the best time to take in a pet.
So
There's
true.
nothing like petting a dog or a cat that just loves you or whatever animal. But doing things to really fill those spaces, like you said.
Yeah, so true. That's totally my language. I say, when we go, ladies, when we go to a spa, you're pretty much by yourself, but it fills all your senses. Everything you smell, everything you see, everything you hear is soothing to you. So you're completely fine and you're by yourself. So we can do something about things like that when we are alone in our physical space. We can create a space that feeds our senses well.
The
That's
last
so
thing that I
insightful.
forgot to mention was just that I found too in my own life, curiosity in a way like fills my mental space. I think sometimes I get too self-focused on myself and I get in my own head, but being curious about like reading something new and kind of letting myself go on this kind of wormhole into some new topic, or I'm trying to learn the guitar, I'm not very good at it, but doing something like that can be really fun, but really cultivating a spirit of curiosity can help get you unstuck off yourself.
Wow, incredibly good advice there. Kind of just reprogramming what your thoughts on joy are for the holidays, where they may come from, whether it looks different than what you thought, if it's a sensory experience, if it's learning something new, just kind of reprogramming how you think. I think that's wonderful advice. And the next couple of questions are focused on kind of what the most important things that you are looking at with your patients at this time of year. As we mentioned, there are many, many different situations that you guys are treating, so it may not be a one size fits all answer here, but I'll start with you, Dr. Nelson, of what do you think the most important thing that you do with your patients are at this time? We talked a little bit about kind of preparing for the holidays, so maybe getting your senses ready, getting kind of your emotions set for knowing what's coming. But when you see your patients at this time, what would you say the most important thing is that you're trying to do with them?
So we are making sure that we're still in this sort of preparation phase. So I'm telling them, like today, I talked to tons of people today, and I'm preparing them that the holidays are approaching. We're making sure that their medications are stable. If they are not, I really focus quite a bit on if they are sleeping and eating at this time of year, because that's really important. Those are usually those early signs when things are not going well. And so if we need to adjust medications for that, but just preparing them how to reach to me during the holiday season, because I also take off time. So how to reach me should there be emergencies. My patients, most of them know at this point, I don't do a whole lot of changes on medications as we get super close to a holiday like this, because it becomes very difficult to know what's not working if you do too much change. But we're just really trying to keep them stable, setting the proper expectations about how the next 6 weeks or so are about to go, and staying on track with their meds.
Anyone else have anything different that they do with their patients during this time?
I would agree with her. I definitely think sleep is a really big part of kind of managing mood around this time, and just making sure that I encourage them to keep a sleep log and make sure that they recognize that they're not getting sleep. And sometimes it's good to have a lot of collateral around this time, because patients will tell you, I'm doing fine, or I think I'm okay. But if they're not really okay, who is that go-to person to be able to share that with you? Um, and even as providers, having a good circle of people who can identify when that you're not your best self or you seemed overwhelmed, someone who can acknowledge that with you. So I would definitely agree with the medication regimen stabilizing, not a lot of changes, ultimately just kind of encouraging more therapy during this time as well, just to give them some balance.
In the pediatric world, it just matters so much in kind of the state that the patient's coming in. Today, I dealt with a crisis situation where someone didn't have a primary care doc or a pediatrician, wanted therapy, had therapy in the past, maybe hadn't had the best fit, but knew that they probably needed more than just therapy. And so we discussed starting an SSRI. And so that scenario is so different from someone who, say, is stable on meds. And with travel, you really need to be thinking about, do you have enough refills on the medicines? And kids we're kind of shooting out to that break for them to come back to get their refills, with a lot of travel. We're talking about optimizing with L-methylfolate, because I don't want to change the medicines. You can maybe, just like Dr. Nelson said, it's going to be hard to get an appointment. So figuring out how to optimize it. We talk more about exercise, setting goals for the new year, maybe adding on a low dose of a different medicine. This is a great time of year to really establish care with the primary care doc if you haven't, and get your blood work before Thanksgiving, before your triglycerides and cholesterol go up further. But really thinking about how are you taking care of your whole health, because the brain is an organ amongst so many other, and we got to be thinking about our whole health.
Very insightful. Thank you guys. I've heard a couple of things consistently here. Stabilization would probably be the biggest one. And so for some patients, as we mentioned, that means leaving their medications alone. For other, that may mean small changes, supplementation. And so I think this is a nice time to start talking about how GeneSight is used during this time of year. We have heard anecdotal evidence that more GeneSight tests may be done during the holiday season. Dr. Brown, does this jive with your experience, or have you seen this before?
I would say in my experience, yes. A lot of times I'm getting new admissions around this time as opposed to follow-ups, and I am seeing patients who are kind of at the end of their rope as it pertains to, I've seen multiple providers, nothing works. And so I want to provide them some clarity and kind of cut that time in half. They've already experienced some failed trials. And for whatever reason that could be, it may not be a genetic indicator as to why it did not yield a successful result. But essentially, I want to provide them with that clarity and let them know what their options are. So definitely, I'm doing a lot of GeneSight testing, did some today, and wanting to offer them that as an alternative and explaining that it's a tool and not a magic one, but it definitely can yield some magic results if we find the right medication.
I'm going to go around the horn and kind of ask this question as well. But for anyone who's on this webinar who isn't aware of what GeneSight is, it's a pharmacogenomic test that can provide information on how your patient may respond or metabolize certain medications and which medications your patient may be at increased risk of side effects for. So Dr. Felkel, Dr. Nelson, do you have a different experience with GeneSight ordering at this time, or did it match pretty closely to with what Dr. Brown has shared?
I would always love to reduce failed medication trials and try to reduce gene drug interactions and side effects. Over the summer, I feel like I have a little less pressure on me to get the right medicine the first time. But this time of year, I get nervous because the clock is ticking with, especially in kids. Like I said earlier, that end of the first semester is coming up. We really cannot afford 6 to 8 to 12 weeks of a trial It's got to be optimized quickly. So I feel that pressure as a provider.
Yeah, I mean, I totally agree. I mean, we as providers, we're also we're trying to enjoy time with our family as well and take a few days off, so that that pressure is on to really get the medication on board, and it for it to be correct, or for those medications to be maximized. I mean, for those of our colleagues that are in primary care, I'd imagine the pressure is even greater because they may not have the follow-ups with the client to ensure that that medication is working. So I could see how you would probably get more GeneSight tests ordered around this time, because not a lot of room for trial and error with 6 weeks left.
Absolutely.
Yeah.
We got a question from the audience that says, at a large practice, they see around 2,500 mental health patients per day with 100 plus providers. So they are at a health system. Many patients come only asking for genetic testing due to resistance from SSRIs or SNRIs. What is the best course of action to do the test, before the evaluation or after the provider evaluates? So basically, I think the question inherently is, in a large practice setting like this, when do you find it best to order genetic testing? I think Dr. Falco, since you work at a health system, maybe start with you.
I always think it's important for the clinician to evaluate the patient. A lot of people practice differently, maybe even on this call, where someone would do it beforehand. But I want to know, do my evaluation first. But I would. It sounds like in such a busy clinic, patients coming these days, they haven't just failed one medicine; they have failed multiple medicines. And I think in the GeneSight studies, patients had to get into the study had to fail one medicine, but on average, like they failed 3+ medicines, which is kind of like what we see every day. So it sounds like there's a lot of patients that could really benefit.
And to that point, responding to this particular question, as Dr. Brown had mentioned, pharmacogenomic testing is one piece of the puzzle. There are many other factors that are and should be used for medication selection, the primary factor being a clinician's assessment and their judgment. So that is in line with what the medical team talks through as well, Dr. Falco, that you can't do it alone in isolation. So Dr. Nelson, what about you?
Yeah, I mean, I agree. Most of the clients that are coming to my practice, I mean, they are being referred because they've already failed, medication. So we're getting the genetic test done, and then I have those results most of the time when I'm doing the evaluation at that time. If you're seeing these patients medication naive, that might be a little bit of a different setup, but mine have been waiting 6 months, 3 months to get in. So I want all the information at the time so that we can get them started and get them going as quickly as possible on the right med.
And I think that's important to point out, as you mentioned, that there may be differences in practice settings. So primary care providers, there may be treatment naive patients versus in psychiatry offices. Usually that's pretty rare, at least from my experiences. So I think that's really helpful. So from what I've been hearing, it is GeneSight is used as a tool with many other factors to help with medication management, stability. If there are minor tweaks that need to be made during this time, it can be used as a tool for patients. And if we have any more questions on the GeneSight test, when to use, who to use it on, please feel free to put them in the Q&A feature. But we will shift gears a little bit here, and we can always go back to talk about more about balancing the load of being a clinician during the holiday season. So for everyone, including clinicians, you are balancing a really heavy load during this time. So what do you do yourself, and what would you advise other clinicians who also want their own holidays to be able to manage them? So I know, Dr. Felkel, you talked about mindfulness, you talked about trying to teach yourself a new skill. Are there any other tips that you guys have to manage the stress of managing other people's mental health during this time?
I think that essentially we find ourselves being so busy just in general. And I think when the pandemic occurred, we really had to think about what we were doing and slow down, and made us more mindful of how busy we had actually been. So I say that to say, penciling in, scheduling some intentional time for yourself. If you block the calendar for that and make it a priority, just like you make the priority to be at this meeting and this event, then it's helpful to see it in writing and highlight that so that you can plug that in and tell people so that you don't crowd that time with other responsibilities. Just essentially prioritizing your self-care and making it concrete, if you will.
Yeah, I agree. I think, just this is the time of year where I think all clinicians have to just practice what we preach,
Yeah.
where we do have to prioritize the self-care, just like we are encouraging our clients and we're trying to stabilize our clients so they enjoy time with their family and friends or whatever they want to do at the holidays. We need to make sure that we prioritize that as well, especially post-pandemic. I mean, this has become a passion I have almost talking to clinicians post-pandemic because we had a lot of burnout, a lot of anxiety, depression among healthcare professionals. So we need to make sure that we structure our careers in the same way so that we get time off. I personally make sure that I take a good amount of time off around Thanksgiving and Christmas. I prepare my clients for that every single year that I will be off. Their questions will still get responded to, but the office will be closed so that myself and my staff can get a break and that we can come back refreshed. And I think that we just have to be mindful of that. I talked to a lot of physicians even this past week, and I was asking that question. So, how much time will you be off? Oh, I'll just have the day off. I was like, is that what you want to do? No. Well, why are you doing that? Because we really have to be good about doing what we tell our patients to do.
Right.
So, so yeah.
Thank you.
I've been trying to live recently by this mantra that anything worth doing is worth doing badly. Um, and so, like, if I set out at the end of the week I'm not going to have a glass of wine this week, for instance. And I catch myself kind of mindlessly having a glass of wine or eating carbs, or it could be whatever. Um, Instead of feeling guilty or like I failed, I try to say, well, you know what? Maybe I could just have half of that glass of wine or those carbs and pour it out. And or if I feel like I didn't get enough steps in the day or I didn't get my 3 mile run in, maybe I park a little bit farther in the parking lot on the way into work because some steps are better than none, even if it's not exactly what my goal was. So I think trying to listen to my body and just be like self-reflective is a goal. Um, I I I feel frequently very restless, and if I get that feeling, trying to identify what is the thought that I'm having that perhaps is creating that emotion, and then once I can identify it, then maybe going for a quick jog to counteract it, or because I work from home a lot, I find myself walking to the refrigerator all the time,
You're not
and
alone.
and I feel this sense of dread because there's like some big decision I have to make, or maybe it's like I haven't bought those airplane tickets. There's some feeling I have in my body, and I haven't quite identified what that thought is. And instead, I'm like in front of the refrigerator, grabbing something, and then as I take a step back, I take a long breath, kind of to activate my parasympathetic system. That kind of long exhale. Um, it allows me to identify that I'm actually sleepy. Like I'm tired, and it had nothing to do with being hungry. So then I'll maybe go take a nap, and maybe I can't get a 30-minute nap, but I'll sleep for 5 minutes because something is better than nothing. So just being easy on myself.
I love that. I love what you said because I say that that's like all or something. It doesn't have to be all or nothing. How about all or something? And then listening to your body. Physicians are and healthcare professionals, nurses, we're not that great always at listening to our own body. I talked to a doctor last week who all week she worked her whole clinic with pneumonia. And I said, well, weren't you short of breath? Well, yeah, but I had to see the clients. Well, now you're going to be out for a month, not seeing the clients because you pushed through the week with pneumonia. So listening to our bodies, I think that's a big one.
I think I heard a couple of really important points that I just want to reiterate. One is kindness. I think a lot of people are much more prone to be kind to others than kind to themselves. I fall into that bucket all the time. And I think that's a really good thing that you can control. You can control the narrative in your head. And so that's something that I think is a really great piece of advice for a clinician or for a patient, of course. And then the point of that, it's sometimes challenging to listen to yourself, because I can speak for myself. I'm a very data driven person, and I find myself looking externally for answers for questions that if I just sat there and actually listened to myself, I could figure out on my own. Like, should I be feeling this symptom? It's like, well, you are if you just listen to yourself. But it's almost sensory overload. You have so much information at your fingertips. It's a wonder, it's a marvel. You can figure out anything within seconds, but sometimes it's almost debilitating because you stop trusting yourself. So I just wanted to reiterate those points because I feel like they're very resonant with a lot of people, no matter what walk of life that you're in. So thank you for sharing those. I really appreciate that. Dr. Brown, do you have anything to add to that?
My grandmother used to say, it costs nothing to be kind, but you made a very valid point. It is often difficult to remind yourself to extend yourself that grace as well. As a patient, as a provider, no matter what, I think it's also important to kind of just remember we're all human and we all have to kind of walk our own paths. So I think each thing Dr. Nelson and Dr. Felkel mentioned was food for thought. Some things I didn't even consider for myself. So.
So one topic I want to throw into this, because you can't have a conversation with mental health about it, is the pandemic. So I had a funny conversation with a healthcare provider the other day, and I said something. I said, "Well, post-pandemic XYZ," and they were like, "Well, I don't even think we're post-pandemic. Like, I have patients with COVID right now." Like, and I was like, I guess that's kind of a relative term, right? Like, some people are still very much licking their wounds from what happened to them during the heart of COVID. Some people feel like they've moved on from it. So when you're meeting with your patients, or, how does that come into play, thinking about how the crises of what's happening in the world are affecting your patients as well?
I would say I still see several patients in practice that are wearing masks and utilizing still the same practices during this time, some for precaution and others for fear. So you see a lot of heightened anxiety around this time. And I think someone mentioned earlier about the news. That's playing a large role in kind of the fear of what will come or the unknown. So, um, yeah, the pandemic definitely has played a large role in kind of influencing our thought process and our behaviors, but just kind of reassuring my patients that the practices that they take are to protect them, but we also have some plans of action if the anxiety begins to increase more than we can control with therapy or just kind of the practices that they're already using. And we may need to increase some medications here. And GeneSight can help us kind of identify if one medication versus the other is not able to get us where we need to kind of shorten that treatment time. So just kind of establishing that early on.
Wonderful. Thank you.
Yeah, I'm wondering if even saying post-pandemic to some people still really suffering or grieving the loss of a loved one who died from it, I guess it could be really triggering. We
Sure.
need to be careful. There's just so many unexplained symptoms still. We just bucket it all as like post-acute COVID, but or long hauler syndrome, but a lot of dementias, mild cognitive impairment that have been exposed, a lot of people just not feeling themselves, lots of rheumatology, aches and pains everywhere, fatigue, dizziness. I mean, you name it, there's someone suffering from that. So my heart definitely goes out to those people, and I still hope and pray that those symptoms will improve over time, but we just don't know everything about what COVID has done. And you mentioned just kind of the crises. That I work with a colleague who lost her whole family in the Middle East from the terrorist attacks, and know some people whose families are in Ukraine, and so these holidays are going to be very hard for many people. Just a lot of conflicted feelings and a lot going on in the world.
Yeah, I agree. I think we have a mixed bag right now. I mean, there's a lot. We have people that are still actively getting COVID and getting very sick. We have people that have lost so many loved ones, and then all of the sort of unrest we have going on in our world. So I think that it just becomes even more important that when we're having those conversations with our clients, that we take time to hear them, whether you're primary care or um, primarily psychiatry. We've got to hear where people are and kind of meet them where they are and give them the advice that fits what they're going through. I see a lot of I see a lot of clinicians and a lot of clinicians. This is the first time in my career I've seen this many healthcare professionals, and it's difficult because there isn't a manual, there aren't directions yet, there's no algorithm how to support our healthcare professionals
Right.
who sometimes even have symptoms of PTSD related to what they experienced during the pandemic. So it's a mixed bag. I think we're definitely dealing with a different level of intensity with the problems that our clients are facing, and trying to figure out how in the process to make sure that we take care of ourselves while we're taking care of them.
Absolutely. Thank you. We got another question from the audience asking about how to order the GeneSight test. Does any lab have the capability to do this? So I can speak to that one at a high level. So you order the GeneSight test on mygenesight.com. We can have your local sales representative connect with you after this to discuss further logistics, but it's a buccal swab. Multiple, 2 swabs on each cheek. It's sent to our lab in Mason, Ohio, and the results are returned usually within 48 hours. So this is done specifically by the GeneSight lab. So if we have any further questions, of course, we can do more follow-up there. And then another question that we got related to this with the GeneSight test is, do you see an uptick in patient requests for GeneSight during the holidays, or do you feel like it's coming from within yourself saying, okay, I think this patient really would benefit from having a GeneSight test?
I would say,
For me,
oh,
it's kind of, oh, go ahead, Dr. Brown. You
oh
can.
no, so sorry. I was just going to say it just depends, really. Some people are familiar with it from other providers, discussing it with them before, and then others are new to it. So I've just been kind of doing it on a case by case basis, but I guess it can vary based off of the patient's knowledge.
Dr. Nelson?
We've been seeing an uptick in general. I can't say that it's related to the holidays, just an uptick in general of patients calling, asking for the test if we do it, or even recently we've had a couple people come where they've had the test done somewhere else, and they're bringing the report and want us to take over their medication management. So I think just in general, we're seeing more people knowing about GeneSight, getting the test done, or wanting the test done, period. That's what we're seeing in our practice.
It's amazing to me still how many providers and clinicians just don't know anything about pharmacogenomic testing. And so I was giving a lecture to some primary care residents the other day, and we were talking about it, but there's still a lot of education that has to go on.
Yes, that is a hurdle that the medical affairs team faces every day, is just awareness. It's very hit or miss depending who you're talking to. It's not in a lot of curriculums, required material for curriculums. So that's definitely a barrier we're trying to address. Do you feel like it's a little bit different in terms of requesting GeneSight in your setting, Dr. Felkel, because you have the patient and the patient's parents?
Sure, I do think probably parents concerned about their kids talk to other parents, and so word spreads quickly in pediatric psychiatry. But
Yeah. Well, we have collected some tips from GeneSight ordering clinicians. So we asked them, what are your top recommendations for managing financial stressors, concerns about excess, family tension, anything like that? I'll read a couple of them to you guys just so we have them, and then I will turn it over to our panelists to kind of leave us with parting words, their best advice for the holidays. I'll start with the first one. So please remember, this is your holiday. While there are many expectations and obligations from multiple sources, this is your time and you have the right to say yes or no. Chances are what you would like to do is likely what others really want to do. And most of the time, when you replay your desires and dislikes, this will lead to a more cohesive celebration. Psychiatrist from California. I often tell patients that in the days when I used to have paper prescriptions, I would write out a prescription to have a migraine. So they could say, I'll say my head hurts, I have to leave. It allows the person to exit without having their self-image damaged or their PTSD triggered. So basically allowing yourself to have a leave when you need to leave. One more, giving gifts adds a unique dynamic. Everyone likes to get gifts. Don't forget to look past the gift to the giver and let them know you appreciate them for who they are, which I think is really important. We did get a comment in the chat about suggesting for individuals to find a way to volunteer or help others in the holiday. So if you don't have money, give the gift of time. I think that's a really, really good piece of advice. So we'll start with Dr. Brown. What do you have one final kind of just parting words, advice? Anything different than what you've said for the providers on this call?
I would say it is absolutely okay to be selfish and prioritize your needs, yourself, and gift yourself things that you need, things that people don't necessarily think to give you. That can be space, time, um, self-care altogether, whatever that looks like for you. But definitely put that on the list of things to do and saturate it.
I love it. Dr. Falco?
I was thinking that I need to stop yelling at my kids, but then I feel guilty that I do, and I keep breaking that promise. I need to find a happy medium, but I'm going to be okay not finding a happy medium. I'm not going to hold myself completely to that, but I would want everyone to know that if you're struggling right now, as we all are to some degree, that there's a provider out there that really wants to help you and take care of you and listen to your story. And so whether you're a patient or a clinician or both, I'm really proud that we've come a long way in psychiatry and primary care, and we can really help get you well.
Thank you. And Dr. Nelson?
Everybody said probably everything. I mean, the last to go, everything's already been said.
I know, the worst. I'm sorry. I set you up for a loss.
Yeah, everything's been said, and I'll just reiterate what I tell my clients. Like I said, start with the end in mind. The day after Thanksgiving, if someone says, "How did your Thanksgiving go? How did your Christmas go? What's the story you want to tell?" And decide that, and build it out as such, so that you get that, whatever that may look like for you and your family.
Well, this was all wonderful advice. I think we heard a lot about how there are techniques for medication management that are paramount during this time, but there are also a lot of techniques that you can do yourself, including mindfulness, including self-love, including learning new things that you can help during this time as well, and meeting people where they are. Everyone's journey is different. Everyone's holidays look different, whether they're full of family or whether there's isolation. So I think we had really good tips for a lot of different walks of life. So I want to sincerely thank you all for your time. I appreciate everything you said, so thoughtful, and I hope everyone has a wonderful night. And thank you for coming out tonight.
Thank you. See you.